Hi, I'm Dr. Rich. I'm teaching you about dentistry and teeth so you can have a very nice smile.
All right, thanks for joining me. Today we're going to be restoring the lower arch of that patient that we just did the upper denture for, full upper denture, and now a lower partial denture. So originally I thought we were just going to try to save his canines and have to extract the two premolars on either side and make them a Q-sill lower denture. But upon further looking at the teeth, they're still in decent enough shape, still stable enough that I actually decided, and talking to the patient, we decided that we're going to try to hold on to all 6 of those teeth for as long as we can. And so I'm going to make a metal framed combination partial denture. So it's going to have a metal framework, attaching to the teeth. Front teeth are going to be replaced with that nylon pink plastic, so we can have some nylon clasps on these two so we don't show any metal when he smiles. In the back, we're going to have some buccal eye bars to hold the distal extension bases. That's the part where the molars are. So this is just the study model that I took an alginate in a stock tray, and I had the lab make me a custom tray. So we're going to paint the inside up with some adhesive, and we're going to border mold the distal extension bases. So just basically this side and this side. I don't think I'm going to bother doing any border molding down here because I believe that the tray covers that enough and shouldn't be that big an issue, but we'll see once I try it in the mouth. If it impinges, I might have to notch the tray for the anterior, for the lip muscle attachment there, the frenum. Same thing on the lingual side for the tongue frenum. But all right, so there's that. So next time let's go prep the teeth in the mouth. We're going to have to put some rest seats. I'm going to put them on the distal, the very last premolars, and we're going to put some ledge rests on the tongue side of the canine. And we'll also might make some guide planes, might not. Doesn't seem too bad. Overhangs don't seem that bad. All right, let's go to the mouth.
All right, so now we're in the mouth. So now I already have an idea, the design of the partial denture. I already have it planned out in my head, so I know where I'm going to prep for rest seats. So I'll take a round burr in my high-speed handpiece and prep some rest seats on the last teeth on the arch. So that's the second premolar on both sides. I'm going to do it on the mesial side because we're going to have a buccal eye bar to help hold it in. Again, just how I was taught where to prep them. And that just gives enough space for the metal to fit into. Not as big a deal against an upper full denture, but if you're up against somebody with teeth on the upper arch, you need to have space for it. On the canines, due to the shape of the canines, I'm going to do something a little bit different and place on there. I placed ledge rest, basically just a line straight across on the cingulum. Now, in all these cases, these rest seats are not very deep. We're still completely in the enamel. Person doesn't need any anesthetic, doesn't need any Novocaine for this. They're not going to feel anything. Doesn't make the teeth weaker, doesn't make them more prone to cavities. Next, I'm just cutting out, removing some of the undercuts on some of the teeth. Now, what's an undercut? Well, let me pause this to show you. So you see how that tooth is not straight up and down? So when we make a partial denture, it can only go in and out in a straight line. And if we leave it as is, there's going to be all this space where food's going to collect. So by removing that overhang, try to straighten that side of the tooth out, the partial can have a much tighter fit against the tooth. And that's what I'm doing here by trimming those overhangs. So I'm going to do that on all the teeth where the partial is going to sit. And it's just going to give me a better fit. It's going to get less food caught around them. I also always tell patients it's a partial denture. It's got all this metal, all these clips, and food is going to get stuck around it. Just how it is. So when you eat with it, you got to definitely remove it after every time you eat. Rinse it out, rinse your mouth out, and then pop it back in. So we're just going around to all 4 teeth, prepping them for rest seats. And then once that's done, then I'm done prepping the teeth and we're ready to start taking the impression. I still use custom trays for taking partial denture impressions. I know a lot of people, they just will take a stock tray, take it in. I know dentists that'll just use alginate in a stock tray and pour that up. But I'm using a custom tray, and I'm going to take the extra step of border molding the distal extension base. Now that's probably overkill in this situation since the person's only missing 2 molars on at the end. More useful if he were missing all those premolars as well and we were just going to be hanging off the canines. Back when I was in dental school, I was actually taught a technique called the altered cast impression technique. That involved making the framework for the denture first. So we take an impression, get the metal framework, and then once the metal framework's back, those distal extension, the ends that are where the molars are, we would border mold those, take another impression with that, and then have the lab alter the cast to reflect that and then make the partial denture on that. Very time consuming. I don't know if anybody still does that nowadays. Since implants have become much more mainstream, I very rarely make partial dentures anymore. This person is just a special case. He was originally thinking of getting implants, and then he told me he watched some videos on YouTube showing the actual surgical procedure of placing the implants, and that freaked him out, so he didn't want any. So we're just taking the extra time to border mold those ends for him. And again, I figured it'd make a good video so you guys can see what's involved. And it's similar to when I took the upper denture impression. We're just stretching the cheeks, moving the cheeks all around. When we get to the inside, I'm going to have him move his tongue all around to get the edges, to get the borders of the denture. All right, so now we're done border molding. Next step, we're ready for the final wash impression. So for this, I'm going to use a light body VPS material, and this one, to give me a little bit more time, I'm not using my normal fast set material. I'm using a regular set. It's a little bit slower, gives me a little bit more time to work, make sure I'm putting the tray in the right way and going through all the border molding processes. So load that up nice and full, and now let's go into the mouth with that. And again, we just want to seat it in fully all the way down onto the teeth and just go through all the border molding on each. Pull his lips all around, pull his cheeks, have him move his tongue every which way around so that we get the extent of the moving parts of the gum tissue, so that when the lab makes it, he'll be able to move his lips around, move his cheeks around, speak, talk without it causing the partial denture to move. And again, we're going to make a combination partial denture. We're going to have the flexible plastic around the front teeth with metal clips on the back teeth. Got to let that set up, and that should be it for the impression. Now we just got to take it out. Yep, checking for this, making sure it's set. It is, and we got some good suction, so let me help remove that and pop that out. And there we go. There's the impression all ready to go. So just a couple little air bubbles there on the front, but not a big deal. All right, thank you guys so much for watching. In the next installment of this series, we're going to be trying in the metal framework and doing a bite relation. Thanks so much for watching. See you guys in the next video.